Good evening, and welcome to the Love Your Liver Black History Month community event. This event is hosted by Blue Fairy, the Adrian Wilson Liver Cancer Association. Blue Fairy's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, through research, education, and advocacy. Through our Love Your Liver program, we work to increase awareness, prevention, and early detection of liver disease and liver cancer in high risk and underserved communities. Thank you for joining us today to learn about how liver cancer affects the Black and African American community. Today, we are honored to welcome Dr. Rebecca Jones from the University of Texas at San Antonio, who will discuss liver cancer risk factors, diagnosis, treatment options, and steps you can take to protect your liver health. At the end of the presentation, we will have a Q&A session with Dr. Jones. To submit a question, click on the Q&A icon at the bottom of your screen, type your question, and click send. You may submit questions at any time during the presentation, but we will answer them during the Q&A portion. We may not be able to answer all questions. Also, please note, this is an educational presentation. Please ask general questions and do not share your personal health information. Dr. Jones is not your personal physician and cannot provide individual medical advice during this event. We encourage you to use the reaction icon at the bottom of your screen to engage with today's presentation. There's going to be poll questions throughout the event, and we encourage everyone to participate. If you experience any technical difficulties, please contact our host, Aura, in the chat. Dr. Jones is an assistant professor at UT San Antonio and serves as the Assistant Director of Community Outreach and Engagement at the Mays Cancer Center. Her work focuses on improving cancer prevention, screening, and access to care for underserved and historically marginalized communities. She leads several research projects aimed at addressing cancer disparities in South Texas, including an American Cancer Society funded study to increase colorectal cancer screening, and a PCORI funded project focused on liver cancer, cervical cancer, and pediatric leukemia. Overall, her work centers on bringing research, care, and community voices together to improve cancer outcomes for patients and families. So let's begin with our first question. Black Americans are more likely than the general population to get liver cancer. By how much? So even if you don't know the answer, guys, please give it your best guess, and give us some thumbs ups once you've actually submitted your answers. We're going to put 30 seconds on the clock and just go ahead and answer with your best guess. And don't forget to thumbs. I'm seeing a lot of thumbs up come up now, so it looks like we're getting quite a few answers. We're going to leave these up for a few seconds to let everyone else go ahead and answer as well. Looking great. Lots and lots of thumbs up. We love it. All right, just a few more seconds, guys. Seeing a couple more thumbs up, so people are still responding. This is excellent. All right. So now the poll's closed. Dr. Jones, can you please share the correct answer and explain why?
Absolutely. Well, good evening, everybody. I'm so happy to be here with you, and thank you for taking time to learn more about liver cancer and how we can all reduce our risk. But the correct answer for this question is actually number D, letter D. So our African American communities are 180% more likely to develop liver cancer, to get liver cancer. And we have an entire session today that is going to talk to us about why that is and what we can do to reduce our risk. So we'll kind of get started. But Chastity, thank you so much for that introduction. And, so I wanted to just start with saying, what is it that we're going to discuss today? And I'm going to start with first talking a little bit about what the liver is, how it works. And then I'll spend some time talking about how common liver cancer is in the United States, but particularly how common it is within our Black and African American communities. We'll also spend time talking about risk factors for liver cancer, what it looks like and what it means to be diagnosed with liver cancer, what available treatments are, and then we'll end on the different steps and actions we can all take to reduce our risk. And then, if you or a loved one have been diagnosed with liver cancer, we'll talk about some of the things you can do to help, as you go through this journey. So let's start with, well, what exactly is the liver, right? And so the liver is the top is it's located in the top right part of our belly. It is the largest organ inside of our body, and it does over 500 different things for us. And it's also the only organ inside of us that can actually regrow itself. And because of that, that does kind of lead to different treatment options, which of course we'll talk about. But the liver is really important because it really does function as our body's filter. It is responsible for removing toxins, it helps to break down fats and cholesterol, and it also helps to break down carbs and proteins. And when we think about liver cancer, right, so cancer that is affecting our liver, we know that liver cancer is actually on the rise in the United States. We know that it's up by 34%, and over 42,000 individuals will be diagnosed with liver cancer, and over 30,000 individuals will die from liver cancer. And so, again, that's why we thank you all for taking some time to learn about this and love your liver. But when we think about liver cancer in our Black and our African American communities, the most common type of liver cancer that we see is actually called hepatocellular carcinoma, HCC. And as I mentioned, it's the most common liver cancer. And the number of people in our Black communities to get HCC has grown by over 52%. And as I mentioned before, we know that liver cancer is 180 times more likely to be seen in our Black and African American communities compared to the general population. But I think one thing to also keep in mind is that we do see what we call disparities, right? And so we know that in our Black communities, we actually have the highest death rate when it comes to HCC and liver cancer. But again, there are things that we can do. We can educate ourselves, we can educate our family and friends, and we can take control of our health to help us manage our risk for liver cancer. Now, there are different types of liver cancers, but we're going to talk primarily about HCC. Now, when we think about primary liver cancer, what I mean by that is this is a cancer that has actually started in the liver, right? So we know that sometimes a person might have liver in a different part of the body that spreads to the liver, but in this case, we're actually talking about liver that starts, or cancer that starts in the liver. And as I mentioned, so more than 80% of the primary liver cancers are HCC. So, what are the risk factors? And before I talk about risk factors for our Black communities, I'm first going to just maybe talk a little bit about what a risk factor is. But a risk factor is essentially a reason why someone is going to be more likely to get a disease compared to the average person. And so, when we think about why we see liver cancer in our African American communities at these higher rates, it's because we have different risk factors. So, common risk factors for our African American communities include our medical conditions, so different chronic diseases that we'll touch on, some of our lifestyle choices, and the reality is that us being of African American and Black does put us at higher risk for liver cancer.
All right. So let's review the risk factors for liver cancer. Which of these are risk factors for liver cancer? Is it A, hepatitis C, B, type 2 diabetes, C, being Black, African American, or D, all of the above? Again, please go ahead and just give the answer to the best of your ability. It doesn't matter if you're not sure of the answer, just give us something. And yeah, go ahead and thumbs up. We're seeing a lot more thumbs up. So this is great, guys. Just give us a thumbs up whenever you've put in your response, and we're going to leave this up for 30 seconds for you. Oh, this is excellent. I
Lots of
love
thumbs
seeing this
up.
much engagement.
I know. And again, thanks for taking time to sit and learn with us. It was over 110 folks on the call today.
Yeah, this is excellent. We love seeing this many people take control of their own health. All right, so we've got just a few more seconds. Oh, we're closed on the poll. So, Dr. Jones, would you mind giving us the correct answer?
Of course. So the correct answer is all of the above. So we know that all of these things are risk factors, and we're actually going to take some time to talk about each of them. So we're going to start with hepatitis B, right? So hepatitis B virus is a risk factor. And so we know that our Black and African American communities are 4 times more likely to be diagnosed with hepatitis B and almost 3 times more likely to die from hepatitis B compared to non-Hispanic white Americans. We also know that chronic hepatitis B can lead to cirrhosis, which is scarring of the liver, and it's when it starts to replace our healthy liver cells. While cirrhosis increases your risk for liver cancer, hepatitis B can actually develop even if you don't have cirrhosis. So when we think about hepatitis B, it really is important that you talk to your doctor to get screened, and that usually is through a blood test. Especially if you haven't been vaccinated or if you haven't been tested. Another risk factor that we want to talk about is hepatitis C. So, hepatitis C infection is the leading risk factor for liver cancer in the United States. We know that our Black and African American communities are 80% more likely to die from hepatitis C compared to white Americans. And hepatitis C can be treated and even cured, with many decreasing, which may help to decrease your risk for liver cancer. But we also know that our Black patients with hepatitis C can actually develop HCC at earlier stages. And so again, if you have or if you have or have had hepatitis C, we encourage you to ask your doctor about getting screened for HCC. And we'll talk more about what that looks like later in this presentation.
Okay, so let's take our third poll of the evening. So Black Americans are more likely than non-Hispanic white individuals to die from hepatitis C. By how much? Is it A, 10%, B, 43%, C, 80%, or D, 120%? And we're already seeing a lot of thumbs up, so it looks like we're getting some good responses. We're going to leave this one up for a few more seconds for you guys to make sure everybody gets a chance to answer. But yes, please keep giving us a thumbs up whenever you respond. Excellent. Seeing a few scragglers. Awesome. All right. So, Dr. Jones, can you please give us the correct answer and its importance?
Yes, of course. So the correct answer is actually 80%. So 80% of Black Americans are almost twice as likely to die from hepatitis C. And I know that I'm throwing out a lot of numbers in this presentation, but we will get to, actually more around how we can all reduce our risk of developing liver cancer. But it is important to understand the risk and how much more common liver cancer is in our communities than most of us really know. So I think when we start talking about risk factors, we're going to start with type 2 diabetes. And so I know we probably all know of at least one person who has type 2 diabetes. But what we do know is that for Black Americans, we are 2 times as likely to develop type 2 diabetes, and we typically have more complications. We also know that type 2 diabetes is linked to an increased risk for liver cancer. And so, again, it really is important that you know what your risks are or what your status is for type 2 diabetes. And if you do have type 2 diabetes, managing your diabetes is really important.
Okay, so we have our next question, and I want to remind you guys, I'm seeing a lot of questions come up in the chat. Please make sure you're putting your questions in the Q&A in the chat so that we can make sure that we get a chance to answer those for you. So for this one, is type 2 diabetes an independent risk factor for developing liver cancer? yes or no. And we're just going to give you a few seconds on this one. Again, please make sure you give us a thumbs up after you answer and just take your best guess if you're not sure. Okay. And don't forget to give us a thumbs up when you answer, guys. All right. So, Dr. Jones, can you please tell me what the answer is?
Of course. So, yes, type 2 diabetes has been shown to be a direct risk factor for liver cancer. And so, once again, it's really important that we really understand what our A1Cs are, that we know what our type 2 diabetes status is, and then if we are, that we're doing what we need to do to manage our type 2 diabetes. So we also, know that obesity by itself is also considered a risk factor. And so obesity can lead to type 2 diabetes and of course hypertension, high cholesterol, and other chronic diseases that we're all probably very familiar with. And we know that obesity is also tied to fatty liver. So there is a more technical term that has replaced the term fatty liver disease, but most folks do still know it in our communities as fatty liver disease. But obesity is linked or is considered a risk factor for liver cancer. And when we think about obesity, we know that most of us have heard of the body mass index, and most of us probably have some sense of what our BMI categories are. And so if you have a BMI that's 30 or above, it's considered obese. If it's 40 or above, it's considered morbidly obese. But we also need to think about our body fat percentages, right? And so for men, that's if you have a body fat percentage over the 25, or if you're a woman, if your body fat percentage is over 33. So if these aren't, two numbers that you're familiar with, I encourage you to talk with your doctor. They can usually tell you this during a visit. In addition to our type 2 diabetes status, our obesity status, we also know that diet is certainly something that is a risk factor for liver cancer. We know that having a diet that's full of red meats, steaks, smothered chops, and diets that have, our high fat sides, such as greens or macaroni, other things like that, really do increase our risk for becoming overweight, obese, and ultimately leading to chronic disease. But there are things that we can incorporate into our diet that will help reduce our risk for liver cancer and reduce and just let us be healthier overall. So, incorporating more fruits and vegetables and whole grains can really help to be healthy and reduce liver fat, which is really important as we think about reducing our risk for liver cancer. There's also lifestyle choices that we make that influence our risk for liver cancer. One of those is alcohol. And we know that for men, you should have no more than 2 drinks a day. And for women, it's 1 drink a day. And that would be, something that we can do to help reduce our risk as it relates to alcohol. If you are a smoker, quitting smoking is something that you can do to reduce your risk for liver cancer. And if you don't know where to start, you can start with your provider, your primary care provider, or any provider can help you with resources and tools that can help you quit smoking. And then also sharing of needles, right? So we know whether it's needles for IV use or tattoos and piercings, really making sure that needles are sterilized is really important and something that we can do to reduce our risk for liver cancer.
Okay, so now we're ready for our next poll question. And it looks like there were some people who were a little bit confused in the chat. So if you're not seeing the react or the Q&A, just run your mouse along the toolbar at the bottom and you should be able to see that. All right, so our question Is being part of a certain ethnic group a risk factor for getting liver cancer? And that's a yes or no. So that one, we're only going to give you a few seconds on the clock. And I'm already seeing a ton of thumbs up. So it looks like everybody was paying attention, which we love. So yeah, we'll let this hang out for a couple more seconds so that everyone gets a chance to respond. And then we'll get to the answer. All right. Just a couple more thumbs up there. Someone said, too bad mac and cheese tastes great.
It does.
It really does.
Healthy alternatives to the extent possible.
All right. So, Dr. Jones, please share your insight on this question.
Of course. So yes, being of certain ethnic groups does, contribute to higher risk for having HCC, which is one of the reasons why we're talking about loving your liver during African American Black History Month, right? Um, so what I wanted to do was, again, I recognize that I've maybe talked a little bit fast and I've definitely thrown a lot of different things at you. But in summary, I think there are certainly things that we can do to know your risk and to take action, right? So when it comes to type 2 diabetes, getting your blood sugars under control, knowing what those A1Cs look like is something you can do. Understanding getting screened and tested for hepatitis B and C, trying to live a healthier lifestyle through diet and exercise and managing a healthy weight, reducing or limiting alcohol consumption, being smart about needle sharing, smoking cessation, and just recognizing that, being African American or Black does have, also mean that we do have higher risk for liver cancer. And so what I wanted to do next is actually talk a little bit more about what does it mean to get diagnosed for liver cancer and what does that process look like? And so when we think about how liver cancer is diagnosed, usually there are imaging tests that might be done, such as CT scans, MRI scans, and ultrasounds. There's also lab tests, right? So getting different blood panels done, looking at your overall liver function, are the types of lab tests that your provider might order, and then having a biopsy, right? So this is taking a small piece of the liver just to see what that tissue looks like. And knowing this is important because a cure may be possible if liver cancer is detected early and if it can be removed by surgery. So again, talking with your doctor about being tested regularly, if you have any of those risk factors that we've talked about so far, is one of the things that you can do to be proactive in your journey to having a healthy liver. And so the same thing, when we think about liver cancer, we also have to think about what we call staging. And staging has two important factors, right? And so the staging is really looking at the tumor itself. And so what does that tumor size look like? If they're looking to see, how big is that tumor? Has that tumor or those cancerous cells spread outside of the liver? And if it has spread, where has it spread within the body, right? So again, we're looking at these two different things. We're looking at the tumor itself, but we also want to look at the liver function. So we want to know, what we're looking to see is there normal function in the liver? And if there is, then it's considered class A. If there's mild abnormalities in your liver function, that would be considered class B. And if there are severe abnormalities, then that would be considered having a class C in terms of liver function. And at this class C, it's often, you might be too sick for surgery or other major cancer treatments. But again, understanding what the tumor itself looks like or where it is, as well as your liver function, are important for us to actually start to understand the stage of the liver cancer. And so there's really three general stages when we think about liver cancer. And that first one is the early stage. This is where the liver cancer can be treated by removing the tumor with surgery or through transplant. And at this stage, it's possible that the liver cancer can be cured. If it's at that intermediate stage, it's what we consider to be unresectable. Essentially, what this means is that the liver cancer has not yet spread outside of the liver, but it might be in a spot where we're not able to remove it with surgery, and it's unlikely that it could be treated with a liver transplant. And when we get into that advanced stage, what this means is that the liver cancer has actually spread to other parts of the body. And because of that, treatment with surgery is typically not likely. But again, it's really important that we understand, what the liver tumor looks like, how your liver is functioning, and that will ultimately help your care team understand what stage your liver cancer is at.
Okay. So now our next question, and we've got some time on the clock for you guys. What are some reasons liver cancer cannot be treated with surgery? A, cancer has spread throughout the liver. B, the tumor can't be removed because of where it is in the liver. C, patients are not healthy enough to have surgery. D, patients refuse surgery. Or E, all of the above. And I'm already seeing a lot of thumbs up. You guys just keep the responses coming. We love it when you guys are knowledgeable and take advantage of the tools to keep yourselves healthy. This is great. And since this one's got a longer list, we're going to leave this up just a few more seconds for you guys so everybody gets a chance to respond. Excellent, excellent. And just a reminder, you guys, if you have questions, be sure to add those to the Q&A. We're collecting those for the Q&A portion of this presentation. And if you're having any trouble with any of this, trying to answer any of the questions, please make sure to let Aura know in our chat. Looking good. Seeing a couple more thumbs ups. And don't forget, if you're not seeing the things, if you're not seeing the reactions or anything in the toolbar, just roll your mouse over the toolbar at the bottom of the Zoom screen. All right. Okay. So, Dr. Jones, can you please give us some clarity on this one?
Absolutely. So the answer is all of the above. And so, yes, when we think about what are some of the reasons why, surgery might not be an option, if the cancer is spread to another part of the body, if the tumor is somewhere where it can't really be reached, if the patient is maybe not healthy enough, or even if the patient has decided that they refuse surgery, those are all options of why surgery may not be an option. But with that said, I did want to talk about the treatment options, and we'll talk about this by the different stages that we've kind of talked about so far. So, when we think about that early stage treatment options, surgery is usually where we start. And in this instance, when liver cancer is caught early, there is a chance that it could be cured. And so, when we think about this, we usually think of it in terms of this local therapy. And this is when the treatment is focused on a specific area. So for early stage local therapies, we're really typically talking about surgical therapy, and there's usually either going to be surgery, which is used to try and remove all of the cancer, or transplant, which is a type of surgical treatment where the liver is removed and a donor's liver is put in its place. And so these are the two that we typically think about when that liver cancer is seen at an early stage. And it is important that to say that, liver cancer can come back. And because of that, it really is important that you continue to get checked and you stay in touch with your care team throughout your cancer journey. So what about if the cancer has been, staged as an intermediate, at the intermediate level? So at this stage, with an intermediate staging for liver cancer, it's typically treated with non-surgical local therapies. And what I mean by that is usually what we do, there's what we call ablation, which is using extreme cold or heat or radio ray waves or microwaves or chemicals to really try and kill the cancer. There's also embolization, which is where they're injecting substances into the blood vessels that supply the tumor with the hopes that they can, shrink or stop the growth of the tumor. Or they might also use radiation therapy, which is using high energy radiation to try to kill the cancer cells and shrink the tumor. So really, when liver cancer is in this intermediate stage, it's usually can't be treated with surgical options, but ablation, embolization, or radiation therapy are the therapies and the treatments that will usually be recommended by your care team.
Okay, so now for our next question, and this one's true or false. There are no treatments for advanced liver cancer. And we've got the poll questions up there. Reminder, if you guys are having any problems, just go ahead and reach out to Aura in the chat. If you do not see the react button, make sure you're rolling your mouse over the toolbar at the bottom of the Zoom screen. And I'm seeing a lot of thumbs up, so we're getting a lot of responses to this question. So that's excellent as well. All right. Looks like we got a few more people. And just a quick reminder, make sure you're using the Q&A to put your questions in. Okay. So it looks like we had a burst of thumbs up at the end there. And we've got this up for just a few more seconds. All right. And really, guys, just take your best guess.
There are no wrong or right answers in when we're learning. So,
All right. So, Dr. Jones, do you want to go ahead and give us the correct answer?
of course. So it is false. Although there are no curative options for advanced liver cancer, there are many medications for folks that are diagnosed at this stage. And we'll talk a little bit about those. And so, one, it's important to understand that 80% of the HCC is diagnosed at stages that are too advanced for the local therapies. But, there's always developments in treatments. And so that is something that, we as researchers are working towards. But knowing that, 80% of HCCs are diagnosed at this stage, there are systemic therapies that can be used, right? And so one of those is chemotherapy. And chemotherapy is a drug therapy that upsets the life cycle of a cancer cell, but it also does that with normal cells. There's targeted therapies, which are therapies that are focused on certain parts of the cancer cell to get in the way of how they grow, how they divide, and how they move. So we really think of this kind of in this concept of like precision therapy. So we're really trying to get at the mechanisms of those particular cells and the pathways to try to influence how that cancer is growing. And then there's immunotherapy, which is treatments that try to make the body's immune system stronger. And so, despite, regardless of what stage you are diagnosed at, there are therapies and options that you can talk to your care team about to find the ones that are going to be best for your particular situation. And I think it's important that if you or a loved one has been diagnosed with liver cancer, don't lose hope. As I mentioned, even if you've been diagnosed with an advanced liver cancer, there are FDA approved treatments, and there are treatments being developed every day, and therapies, that are being offered through clinical trials. And again, the way that you learn about this is by having conversations with your care team. With that being said, it is really important that you find doctors that specialize in liver cancer because they can help you find the best options for you or your loved one. So if you or a loved one have been diagnosed with liver cancer, finding an oncologist that specializes in HCC is really important. Looking for a hepatologist and a gastroenterologist is also important, right? So combined, you will have your care team, and this care team will help you find the best course of action and the best course of treatment for you and your loved ones. And so, if you have been diagnosed with liver cancer, in addition to working with a liver cancer specialist, there are some other actions that you can take. One would be to really manage your weight, try to eat a healthy diet, really keep track of your energy, try to find ways to work around when you're feeling tired. Eating a balanced diet will help potentially with your energy levels. And it's really important that you stay hydrated, right? So drink lots of water as you go through this. And it's also really important that you understand that there are individuals that are there to help you. So there are resources available to help you navigate this journey. You are not on this journey alone. And asking for help when you need it is critical for your self-care. So just to summarize and recap, right? So one, I think it's really important that we all understand our risk for liver cancer. It's also important that whenever we can, we make the healthier choices, right? So really understanding, trying to maintain a healthy weight, trying to make sure that we don't have a poor diet or having a balanced diet, making sure that we try our best to manage our type 2 diabetes and in all of our chronic diseases, if you have multiple, can really help reduce your risk for liver cancer and your risk for other health conditions or health problems. We also encourage you to take action. So make appointments to see your family doctor. If, as we went through this conversation, you were able to identify multiple risk factors, take that information with you to your next doctor visit. One of the things you can do is be your own advocate and be proactive and let your doctor know, like, hey, I noticed that I have, X, Y, and Z, and this puts me at increased risk for liver cancer. Are there things that we can do together to get a better sense of what my liver function looks like? And maybe what we do, we call it like establishing a baseline so that it can be screened and looked at every time you go for your annual wellness exam or every time you go in for a visit. It's also important that you know your options. So even if you have been diagnosed with advanced liver cancer, you have options, and a specialist and having that care team can really help you figure out what your course of treatment should be and what's going to be best for you. And then really keep in communication with your doctor. So follow your doctor's treatment plans, keep your notes, and make sure you discuss any of the side effects that you might be having if you or a loved one is currently on their liver cancer journey.
All right. So now this is the final question we have for our audience. So what will you guys do after this seminar is over? Is it A, make an appointment with your doctor? B, get screened? C, tell your friends about this information? Or D, all of the above? We've got a lot of thumbs up, so it looks like a lot of people are really prepared to take some action after this, which we love to see. So we're going to leave this up so that you guys, everybody gets a chance to answer. And then once we're ready, we'll turn it back over to Dr. Jones for some closing remarks and jump into you guys' questions. In just a few more seconds here, guys. And don't forget to hit the thumbs up when you're answering the question, you guys. All right, I'm seeing a last little flutter. All right, we're going to close this in just a couple of more seconds. So if you have an answer, go ahead and get your answers in, guys. All right, so Dr. Jones, do you have any closing remarks or anything about the poll that you specifically want to address?
Of course. So after this seminar, my hope is that all of us will take the positive actions for our health, our family, and our community. And I
Okay.
look forward to answering questions that y'all might have.
Excellent. So before we get into the Q&A, I want to take a minute to thank our sponsors, Merck and Genentech. They are the reason that this was even possible for us to put together. So we want to say a nice thank you to them. And then we are going to jump into some questions from the audience. All right, so let's go ahead and do that. So the first question I have, and this is actually a really good one that I'm interested in the answer to myself. Why are we more likely to get these diseases compared to other races? Is it because of a lack of healthcare availability and affordability, or is it genetics?
Of course, and I think that's a fantastic question. And the answer is it's a little bit of both, right? But so why? Why are we seeing increased reach of HCC in our Black and African American communities? Well, part of that is because of, we know that we have chronic diseases, right? So we kind of talked about risk factors today, right? So having type 2 diabetes, your risk or having hepatitis B or hepatitis C, things like those things are all kind of contributing to our risk for developing HCC. But we also know that if we are not talking to our doctors about our risk, or if we don't know our risk, then it's possible that by the time we present ourselves to the doctor with, we are having symptoms which will kind of make it to where the liver cancer is being diagnosed in those later stages, right? So it's a little bit of both, but as I mentioned, there are things that we can do to be proactive about our health and reduce our risk for liver cancer. I will say in terms of the genetics, so, currently, what we do know is there are not, we don't necessarily know or say that there's a genetic predisposition for liver cancer. But with that being said, if you have family members who have been diagnosed with liver cancer, you should certainly let your provider know that because, again, it's all about prevention and early detection. So, and with your doctor, they will help you decide whether or not, getting some kind of genetic testing or would be beneficial. But I think one of the most important takeaways from today would be, make sure that you understand your risk and that you can be your biggest advocate and talk to your doctor about those risks.
Okay. Thank you. That was excellent. So then the next question is, can liver cancer risk factors still apply to a Hep B diagnosis that was over 40 years ago?
And so if the liver cancer was diagnosed over 40 years ago,
No,
or
so it says, so the Hep B diagnosis was over 40 years ago. Are liver cancer risk factors still applicable?
gotcha. So that is something, so that's a great question. What I would say to that is your doctor would probably be the best person to understand what your current risk profile looks like, given, the duration of the when you were diagnosed with Hep B. But I think knowing, again, one, I applaud you for knowing, having those tests done back then. But talk with your doctor about your current risk profile based off of um, your specific health profile.
And before I get to the next question, I just want to remind everyone that the replay link will be available once this is done. We'll be sending out the replay link. So if you missed something or you came in late, no worries. We'll get the full replay over to you. Okay. So then our next question. How does non-alcoholic fatty liver diagnosis impact overall cancer risk? Is it usually a precursor to liver cancer?
It's a really great question. So, non-alcoholic fatty liver is really the accumulation of fat in your liver, right? And it's this accumulation of fat that kind of starts to destroy the liver cells and causes the scar tissue that we see on the liver, which can lead to cirrhosis. So, non-alcoholic fatty liver disease, right? And cirrhosis can actually independently or separately influence your risk for liver cancer. I think one of the things to keep in mind, and if I don't lose track of the question being asked, is just that, the two by themselves can be risk factors for developing liver cancer. There's a lot of, not a lot, but there are, there's blood tests that you can request from your provider to help you understand how your liver is functioning. But there's also scans. I think one of the most common scans that people might have heard about before is like the fibroscan, which can help kind of understand how much scarring or what your liver kind of looks like, right? And so fatty liver is certainly a risk factor. Cirrhosis is certainly a risk factor, but they are not the only risk factors that can contribute to liver cancer. And so, again, just kind of establishing that baseline with your doctor is one of the most proactive things you can do to keep your liver healthy and know what your liver function is looking like long term.
Hmm. The next question is also related to non-alcoholic fatty liver. Can non-alcoholic fatty liver be reversed, and what is the new name for fatty liver?
Sure. So, yes, it can be, well, let's see. So, can it be reversed? There are things that you can do to reduce the amount of fat that is accumulating on your liver. And so, having losing weight is one of the ways that you can reduce fatty liver. Your diet, being physically active, ensuring that you're managing your chronic diseases are all things you can do to reduce the amount of fat that's being accumulated on your liver. The the new term, and I'm gonna blank on this right now, so forgive me, it's been a very long day for me, but I mean, I think the term that most of us all know is it's still, outside of the field is fatty liver disease.
Okay. Um, so what are some signs and symptoms that you have fatty liver or are headed towards liver cancer? What are some symptoms of liver cancer?
So it's really I think what I would say to that is when it comes to liver cancer, usually by the time that someone is presenting at those advanced stages, it's because they've developed abdominal pain. They might be jaundice, right? So the yellowing of the skin. And there's loss of appetite, really quick weight loss. These are all physical signs that people that have been diagnosed with advanced liver cancer usually present with. And what was the other part of that question? Sorry.
Um, the other part were what are some symptoms of liver cancer?
Okay. Um, well, so those are the symptoms that would be associated with like a diagnosis of liver cancer.
Hmm.
But I think those would be what you would pretty much present with if you had liver cancer.
Okay. Um, let's see. Then I see a question here that says, is type 2 diabetes reversible?
So it is with the appropriate steps in management and working with your provider, right? So type 2 diabetes is really when your body has problem. managing your insulin, right? So we develop insulin resistance. And so if you are committed to, managing your weights, and usually it does require weight loss, watching what you eat, becoming more physically active, increasing your muscle mass, these are all things that can help to actually reverse type 2 diabetes. And so it does require a commitment to a healthier lifestyle and a lifestyle change. But yes, type 2 diabetes can be reversed.
Um, so when you say that it requires some lifestyle changes, is that just more like diet and exercise, or are there other things that they can do lifestyle wise?
Yeah, so I mean, I think, well, lifestyle, so definitely like, so reducing your weight is reducing weight, having a balanced diet, physical activity, likely still needing to take, medications to help with your insulin resistance, are all things that you would have to do. But I would say that the best approach for managing your type 2 diabetes would be working with a dietitian, working with your primary care doctor or your endocrinologist, right? So that you can really do what's needed to monitor your A1Cs and your type 2 diabetes.
That's really good information to have. Thank you. I didn't realize that you could reverse it. So how often should one get a fibroscan?
So that is really dependent on your risk profile. And I think the best person to determine how often you should be getting fiber scans would be your provider. But what I do know is that, if it's something that you can get, it is a really insightful screening to understand your risk for fatty liver. So I would encourage you to talk with your doctor about the potential of getting a fibroscan. It's a really useful scan to understand what your
Okay.
liver is looking like.
Can you just give a little bit of a clarification about what a fibroscan is?
Sure. So it essentially, if you think about like an ultrasound, it's a very similar kind of test, and it's really looking to see. It's very much like a ultrasound, right? So they're
Hmm.
looking at the liver in this kind of like 3D way, and they're really looking to see like how much fiber or scarring there is, and like how dense or loose the tissue is like around your liver.
Oh, okay. So the next question, um, this one's, can you please tell us if inflammation is a risk factor? They didn't
So
specify what type of inflammation.
sure. So, I don't know if I'll be able to specify the type of inflammation, but I will say that inflammation is one of the leading risk factors for developing multiple cancers. So, not only liver
Hmm.
cancer, but other cancers as well. What we do know is that inflammation is really tied to different chronic diseases, right? So we know that hypertension, type 2 diabetes, those are two chronic diseases for sure that can actually contribute to inflammation, as does obesity, right? So all
Hmm.
of these things kind of lead to inflammation within our body, which has been shown to be associated with developing different types of cancers.
And then the next question, and this one I think is a really good one. Um, are there tests to detect liver cancer, and can they be done by your PCP, or do you need to go to a specialist?
It's a great question. So there are blood tests that can be conducted by your primary care to help understand your liver function. Some of those blood tests that you can request are like the AST and the ALT. So those are really two key tests that come up in basic panels that can help to understand kind of what your risks are. They're really just they're elevated. So, but those are two blood tests that you can request. There are other ones, right? Like just kind of looking, and your providers would be the best to know, but you can request tests at your primary care with your primary care physician to
Hmm.
just understand more about your liver function. Sorry.
Okay. So we can actually, so our PCPs would be aware of what tests we need to take without us having to go to a specialist.
Correct. And
Okay.
if nothing else, definitely you want to ask about the AST and the ALTs.
AST and ALTs. Okay. So the next question, is bile duct cancer the same as HCC?
So, as a researcher, I don't know if I'm best to answer that question.
Hmm.
So I think I might defer to the experts on bile duct and HCC being the same.
Okay. All right. Um, let's see. The next one, does high cholesterol cause liver cancer?
So it's not necessarily so high cholesterol can contribute to inflammation. High cholesterol is maybe not like one of the leading risk factors, but it's certainly a risk factor in when we think about having comorbid chronic conditions, right? So
Hmm.
having the hypertension, having the type 2 diabetes, we know that those kind of go hand in hand with high cholesterol. So in some way, high cholesterol is likely contributing to your risk for liver cancer.
Oh, that's good
But
to
I don't know if I would say that it's an independent risk factor for liver cancer.
know. Okay. Let's see. So then this next question, and I'm actually curious about this because I see this a lot. Do over-the-counter liver supplements help?
Hoy, so that is something. So what we do know, right? So there's a lot of talk, and you might have family, friends, or have seen things on social media about, supplements or de liver detoxes. I think one of the things that I would encourage all of you to think about is the fact that our liver is its own kind of filtration system,
Hmm.
right? So the liver actually, its job is to detox, right? It keeps our system healthy in that regard. And so, I think one of the best things you can do for yourself is, and I know it sounds so easy, and I recognize it's not that easy, but trying to really, have a healthy lifestyle, stay hydrated, be a little bit more physically active if you can, quit smoking if you're currently a smoker. Those are all things that are evidence-based that we know can help. Um, with your liver health, right? Overall health, but also with your liver health. But when it really comes to those supplements and those liver detoxes, I think it's just understand that those things are usually not very well regulated, and they could potentially actually do more harm to your liver than good. So
Mm-hmm.
sticking with those those things like healthy lifestyles and those are kind of your best bets. And also talk with your doctor, um, but know that there are risks and associated with and not a lot of evidence around liver detoxes and supplements.
Okay. So we're getting short on time. One of the questions I did want to get to this question. If the liver can regrow, how does that correlate when someone has liver cancer?
Absolutely. So I think it kind of goes back. So one, this is where it would be important to talk with your care team, right? And that liver cancer specialist. But kind of thinking about those different stages that we kind of touched on earlier, right? So, if you are diagnosed with liver cancer at an early stage, it's possible that they could remove the part of the liver that has been affected by the cancer cells. And in that regard, it's possible that your liver can regrow itself. But when it comes to some of those advanced stages where the cancer cells have spread, that's where where they kind of say, your liver being able to regrow itself may not, it's not necessarily an effective solution or treatment option when you have advanced cancers.
Mm. Well, I want to thank you very much for taking the time today to be with us. And I definitely want to thank you, Dr. Jones, for such a wonderful presentation and thank everyone who joined us today. We learned about liver cancer risks, about prevention and treatment options within the Black and African American community. And I want to let everyone know that to learn more about liver cancer and liver health, please visit us at loveyourliver.us. Please prioritize your liver health and speak with your doctor about your individual risk factors. And thank you all so much for your time and your participation. I hope you all have a wonderful, wonderful evening and that you all learned about loving your liver this evening.
Absolutely. Thank you all so much.
Thank you.